Welcome back. In this last physio lecture of labor, we are going to learn what happens during labor and delivery, ending up with a beautiful baby, hopefully. So just to recap, we have some changes that occur pre-labor. So I'm going to just hit a few of the highlights from before and add a couple hormone names. So as you know by now, estrogen is peaking in the last weeks of the pregnancy, courtesy of some fetal hormones. And so we have increased receptors of oxytocin in the myometrial smooth muscle of mom's uterus. Now, these high estrogen levels cause a hormone known as connexin to be produced. And it's this connexin hormone that causes all the gap junctions to proliferate between the myometrial cells. Now, in addition to connexin, there's another hormone, and this one is made by the ovary known as relaxin. So in order to understand what relaxin is doing, go back and think what you know about the anatomy of the cervix. As you recall from before, there's no smooth muscle in that distal part of the uterus, and the cervix, in fact, is just elastic and collagen fibers. And so what relaxin does is it causes the digestion of the collagen there in the cervix. So this is the enzyme which is going to be, we're going to have enzymes digest this. And so what this does is it makes the cervix soft and flexible, and it allows the elastic fibers to allow it to expand. So in the last trimester, the last 25–30% of the pregnancy, the oxytocin and the progesterone, as I mentioned before, causes these practice contractions to occur. And so you start having these weak sporadic contractions, as you can see in the two graphs to the left. And all pregnant moms get used to this, and you realize that you will have a few contractions. Maybe they'll last for 10 minutes, maybe they'll last an hour or two, but they all go away, and they're really not that painful. But they are they're a hint about what is going to come when you go into true labor. So all of this happens before true labor occurs. So when we are talking about labor, we have three distinct stages, and stage 2 and 3 are very easy to define. So let me spend just a little bit minute, and I'm going to go through every stage one by one, but let me just spend a moment talking about the first stage. The first stage of labor actually can be divided into two parts, what's called the latent phase and the active phase. Well, once you're in the active phase, we know you're really in labor. So yes, you're in the first stage of labor, but during the latent phase, it's really difficult to tell the difference. Are these just Braxton Hicks contractions, or are these actually doing anything? Especially first time mom, because this latent phase can basically, you're having some contractions. Okay, they can be painful, but they're nothing like real more progressed active labor is going to be like. On your first time, you don't realize this. And a little bit of changes are happening in the cervix, but not a whole lot. And so if you count this latent phase, this is why lots of women can say, oh, I was in labor for 48 hours before you were born, and Sonny, you owe me for the pain I went through this. Okay, first clue is called labor for a reason. It's a hell of a lot of work to give birth to a baby. So it's not like having a bowel movement where you just push in there, it is, okay. So this latent phase, it's really common to have some contractions and then for them to ease up, and you actually can sleep for a few hours. They'll go away for an hour, for 6 hours, whatever, and then they come back. So let's talk about stage 1 of labor. And stage 1 of labor, it's all about the cervix and what's happening to the cervix. And there's two major things that have to happen at the same time. The first one that starts is called effacement. And what effacement is, the cervix normally is quite thick, about 1 inch in thickness, and it has to thin out to where it becomes just a thin rim. And so as it loses its thickness, we talk about percentages of effacement. So before you start labor, it's 0% effaced. And by the time you're going to get anywhere close to the second stage of labor, it needs to be 100% effaced, or at least 90% effaced. The second component has to do with dilation. That tiny little cervical os, which in a lady who has never given birth vaginally before is about the size of a lead of a pencil, has to go and dilate to 10 centimeters. Okay. So if you take these two fingers and you stretch them out about as far as they can go, that gives you 10 centimeters. Okay. So a lot of stretching has to occur. And if it doesn't stretch out to 10 centimeters, that baby's head never going through that, because that baby's head is a good 9.5, 9.75, 10 centimeters in diameter. Some are a little bit bigger than 10 centimeters. So both of these things are happening during that first stage of labor. So here is something, this wooden thing is often found in teaching hospitals for labor and delivery, so that nurses, when they're doing the, or doctors, when they're, or more likely students, when they're doing the examination, can figure out from the spacing between their fingers exactly how dilated it is. And it's also good for upcoming moms and dads to see where they are and where they need to go to in order to be having a beautiful baby born. So most effacement will occur before most of the dilation occurs. So this is why at the beginning it takes forever for the numbers of dilation to increase. People will say, oh my goodness, I've been 2 centimeters or 3 centimeters dilated for 6 hours. And it's not because nothing's happening with those painful contractions, it's just that the effacement is occurring. So with the contractions, what is happening? Well, both oxytocin and prostaglandins are having their effects. And in fact, they both start having effect within about half an hour of each other as this effacement, this thinning and the dilation occurs. And a lot of this happens before it goes into true labor, especially if it is not your first pregnancy. So what normally happens for about 7, 8, 9 months of pregnancy in the cervical os, there tends to be a plug of mucus, which prevents stuff from going in and stuff from coming out, which is great. And that mucus plug is lost. And sometimes you know about it because sometimes there's a bloody show when it comes out, and other times it just comes out in the toilet and you just had no clue that you have lost your mucus plug. So, you don't really have to focus on the mucus plug, except that we know that it's there. And so the baby's head is going to be pushing down on the cervix. And as we know, we're going to have that positive feedback giving us lots of oxytocin. And oftentimes what's happened is the amniotic sac will spontaneously rupture or leak. Now, sometimes this happens before the mom has what she calls true labor. Maybe she's been having the Braxton Hicks, but it's been causing enough an effect that it leaks. Now, once the amniotic fluid has left, that means you don't have this soft fluid, smushy stuff between the hard baby's head and the cervix, and that allows the head to have a more direct push on the cervix, thereby putting you into active labor, usually within half an hour. And the contractions start becoming strong at least 10 to 15 minute intervals. So when we are looking at the uterine contractions of labor, let's just put it this way, not all contractions are the same. At the beginning, in the latent part, everybody is very positive and laughing and having fun. And yes, the contractions hurt, but you're able to watch TV shows or read or talk on the phone or talk to all your friends you've invited to watch you give birth or to sit with you while you're in labor. And from here, you can see that we have contractions, but they're very irregular. In active labor, they start becoming regular. Now, we tell first-time moms and most moms Don't waste your time going to the hospital until your contractions are religiously every 5 minutes or less. Okay, 6 minutes doesn't count, and they've got to be under 5 minutes, because then we know that you're out of that latent phase and you're truly in labor in the active phase. Now, at this point, the contractions are not all going to be super hard. Some will be lighter, some will be harder, and they still can be variable. 4 minutes, 5 minutes, somewhere in there. So you can carry on conversations, you're doing some work, but you're still able to watch TV. And then at some point in time, you're going to reach the hell of labor known as transition. Because in transition, it's nothing like the easier part where you were sure you could do this labor without an epidural. Now, once you're in the throes of transition, it's too late to ask for your epidural. So if you're having trouble coping with your contractions by the time you are 6-7 centimeters, that's the time to ask for your epidural before you hit transition phase. Transition phase, we get a lot of nervous input because a lot of what's going on. Moms are very irritable. They're ready to call it quits. I cannot tell you how many times I've heard moms say, okay, this is it for the day. Give me something to stop the labor. I'll come back tomorrow. I have hit my limit. But there's no way to stop this labor. Oftentimes, mom will be very nauseated and vomiting at this point as well. So here's what's happening. She's having super strong contractions and they are super close together. In fact, the transition phase, which usually lasts about an hour to up to 2 hours, what's happening here is these super hard contractions, as you can see on the bottom right, are the hardest contractions. Notice that these are 2 to 3 times stronger than the contractions she was having earlier when she was in labor. Okay, she was in labor, but these are a different type of contraction. And not only that, they tend to last 60 to 90 seconds with only a 30-second break before the next one. So you barely can go, okay, it's not killing me yet. I'm not dying when the start of the next contraction has happened already. So moms are not happy. This is not the time to start taking pictures saying, smile, the baby's almost here. She's not having any of it. Okay. So with this, we are done with stage 1 and we are able to say officially, you're in the 2nd stage of labor. So here's what's happening at this point. The baby's head is now descending through the pelvis. And so we talk about the fetal station, where the top part of the head is in relationship to mom's pelvis. And the landmark that we use are those ischial spines, because those are medial in mom's pelvis and they can be easily felt. And you go from the ischial spine to where the head is. And so basically what is happening at this point is the fetal head, which was above the ischial spines, is now at the ischial spines and is going to start descending even lower. Now, this actually requires the baby to change how it is lying inside the mom. If you look these pictures in the upper right hand corner, you can see the orientation of the baby's head as it is descending through the birth canal. The fetus has to rotate not only its head, but its torso. So let's look first and see what's happening with the head. It starts at this angle like this, and the reason for that is the baby's head fits between the pelvis a lot easier when it is sideways, but when it gets down to the ischial spines, it doesn't fit like that, so it has to change the angle to about a 45-degree angle, and then as it goes deeper, the biggest dimension becomes anterior to posterior rather than side to side. So it has to totally rotate, and it rotates so that the baby's head comes out nose down. Okay. After the baby's head comes out nose down, it automatically rotates to semi-sideways because its body is still sideways somewhat, but it has to rotate that You have to now rotate the entire fetus, and you have to get the anterior shoulder out first before the posterior shoulder can come out. Otherwise, the baby gets stuck in the birth canal, which is never a good thing, as you can imagine. So the second stage of labor is going to end with the birth of a baby. And oftentimes you can tell babies that were born through labor because they come out with these cone-shaped heads or these very elongated heads. And that's because the head, and remember, we have bones which have not fused to each other in the cranium, and so they actually can overlap a little bit and change the fetus head shape so that the fetus can come out with the head molding to the mom's pelvis shape, but come out as large as possible and without breaking too many of mom's bones, although a fracture of a coccyx is not uncommon on the mom's part. And so this goes back within a couple of days to the normal fetal head shape. So don't worry about this. You are not going to have a cone head in your child's head for its entire life. Now, after birth of the baby, you are still in labor. It's called stage 3 of labor, and this usually lasts about half an hour. It can be a little bit shorter. So after the birth of the baby, there tends not to be a contraction for a while, and this is while it takes. And typically, if you're in a hospital at this point, we give mom an injection of synthetic oxytocin so that it will promote her having another contraction or two so that she can get through stage 3 of labor on her own. So stage 3 only takes about 1 or 2 more contractions. And what happens is that first the placenta separates from the wall of the uterus. Now, you never want to be pulling on the umbilical cord to try to pull the placenta out because that rips it, which is why now it's standard medical practice to give that oxytocin injection so that you have the contraction on its own. Sometimes we rub on the uterus to try to stimulate it to have a contraction as well. Once the placenta has started separating from the uterine wall, it will then descend within mom's uterus, make its way down to the cervix, and hopefully come all the way out on its own without having to be pulled on. And some parents want the placenta to be left attached to the baby, so whatever blood was in the placenta goes back into the babies. Other parents, doesn't bother them. They will cut the umbilical cord before the placenta is delivered. But once the placenta is delivered, it is super important before we say, okay, mom, you're all done. We can take you to your own bed and wash you up. You've got to examine that placenta. Now, the fetal surface is nice and smooth. You can see the fetal membranes. You see the beautiful tree of life of the blood vessels on the placenta going to and from the umbilical cord. But the side to visually closely inspect is mom's surface. So the side that was attached to mom's uterus, the maternal surface, which is not nice and smooth. But it's very important to inspect this to see if it looks like there were any areas of the placenta which were torn off, because if they were, you need to get those out of the mother, because if you don't, she can get a really bad infection really quickly and be dead within just 24, 48 hours. So this is the end of the third stage of labor. We have delivered, everything is fine. It's time for the bonding to occur now. I also want to point out that having a C-section is a real birth. And for all of you naysayers out there who say, but she didn't have to go through labor and the pushing of delivery. Well, a lot of C-sections are born to mothers who have gone through the labor the baby just didn't descend, or the mom was too small and the baby was too big, or for whatever reasons. For instance, she had a previous C-section. The maternal and fetal mortality tends to be less, which is why there's a higher incidence of this. But this is a real operation, folks. And so mom can't lift anything heavier than 10 pounds for 6 weeks. So she gives birth to a 10-pound baby. That means she's not supposed to be lifting her baby after about the first week of birth. And you try telling that to a new mom, that's not going to happen. So I want to thank you as we end this course with new life. And thank you for all your hard work and interest in anatomy and physiology this semester. And I will see you in class soon.